Well, some people only go to the doctor when something is wrong, but that might not be actually good enough.
Yeah, Dr. Deena Adimoolam joining us now to talk about health screens that we should be getting at every age. Welcome back to the show.
Thank you so much for having me.
All right, so are these type of tests, like what type of tests should New Yorkers be getting in terms of an annual thing?
So I'm always recommending that every year people get a physical examination. That's really important because at that physical, you'll have your blood pressure evaluated, you'll have your weight checked, and you'll make sure that you're in a healthy place. You'll also have an opportunity to talk to your doctor about any medical complaints that you have and discuss your family history, which is really important, especially if you have risk factors for developing some genetic issues that will need to be screened early for.
We know at different ages you start experiencing different things. Let's talk about what health screenings you should be going in for in your 20s and as well as your 30s.
So in your 20s, it's recommended for women to have a cervical cancer screening through a pap smear. So that's usually recommended every 3 years. We also want to make sure that there's no risk for any sexually transmitted diseases or infections. So doctors will screen you for that with blood work. And then important to be looking at depression screening as well. We know during the pandemic, we've had increased risk of depression and anxiety. So having screening for this is also very important. If you're at high risk for issues like diabetes or cholesterol, you can get that checked with blood work, and it's important to be screened for this as well as liver problems and kidney problems too.
All right, let's talk about your 40s. Once you hit your 40s, what should you be getting screened for at that point?
So starting at age 45, we typically recommend colorectal screening. That's usually done via a colonoscopy. It's a test that many people are nervous about, but if you're concerned, you should talk to your doctor. Those at high risk, we typically say they need a colonoscopy every few years, but there's also option for less invasive testing like fecal occult blood tests where you take a stool sample, you send it for blood work, and then you can also get certain DNA markers checked in your stool as well for colorectal cancer.
You mentioned certain things can test your blood and things like that. How do they test specifically for depression?
So there's depression screening markers that we use via these certain questionnaires, and depending on that, we'll discuss whether or not people are at high risk, low risk, or moderate risk.
All right, and then now let's move on to the next, the 50s. What should you add to the in terms of your annual exam once you hit your 50s?
So in your 50s, for women, we typically recommend mammograms. Mammogram is important because some women might need a mammogram sooner than 50, so it really depends on your risk factors. If you have breast cancer in your family, talk to your doctor about when the best time is to get a mammogram. Some women don't like mammograms. They would rather have some other types of screening tests like an MRI scan. So that's another way you can actually check for breast cancer. And then we have our patients that are long-term smokers. We actually recommend for them to have a CT scan of the chest to help diagnose early lung cancers.
Okay, what about those 65 and up?
So for 65 years and older, we're really paying attention to our women who are in menopause. So menopause is a condition where you have decreased estrogen, which is protective of our bones. It leaves our bones frail and brittle, predisposing us to osteoporosis. So it's important to get your osteoporosis screening done via something called a bone density test, which is just an easy x-ray of your hip and your back to make sure that your bones stay strong.
All right, we got to put this all to memory. Thank you, Dr. Deena. Thank you so much for your time today. We really appreciate it.
Thank you so much for having me.
All right, and for more health tips, you can follow Dr. Deena on Instagram. Her information, you see it right there on your screen.